Get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Yaffe here, so I'll turn it over to them for brief remarks.
Good afternoon. Of course, it's Monday, so we're reporting on what happened over the weekend. So first with the numbers and that, I'm going to hand things over to Dr. Yaffe to talk about the data that we have that has been presented for us today and how things went over the weekend. So over to Dr. Yaffe.
Okay, thank you. Good afternoon, everybody. I hope people had a good weekend, stayed home, and stayed safe. Since our last update on last Thursday, Ontario is reporting an additional 7,717 cases of COVID-19. When we look at similar time periods over the month of January, we have been seeing a steady decrease in the number of cases. January 8th to the 11th, we had just under 15,000 cases. January 15th to the 18th, just over 12,000. January 22nd to the 25th, 9,396 cases. So it is going down. Our 7-day average is currently 1,889 daily cases in the last week, which is down from 2,371 the week before and 3,035 the week of January 12th to the 18th. In today's report, we have a total of 1,969 cases, but that includes 300 that were previously reported from Toronto. So we really have about 1,700 cases or so. And our positivity rate is around 3.7% from yesterday. The 7-day count for outbreaks, we are now reporting 21 new outbreaks today, which is lower than what we reported on Monday. Last Monday, 28 outbreaks. The 7-day count for outbreaks has gone down by 35 over the last week, and we will hopefully continue to see these numbers go down. Overall, there is reason for some optimism. We're seeing the impacts of this lockdown and its effects of the stay-at-home order as well. With that said, we do continue to see elevated number of deaths, unfortunately, associated with COVID-19. Since last Thursday, another 210 people have lost their lives, and we do offer our sincere condolences to their friends and family. And while we have seen a stabilization in the number of hospitalizations at about 1,158 and ICU patients at 354, we would really like to see those numbers come down further. With that, I'm going to turn it over to Dr. Williams. Thanks.
So today, we're also reporting that we have a total of 69 confirmed B.1.1.7, the so-called B117 UK variant of concern cases in Ontario. And we'll be continuing to update that as we do our methods of testing with our technology that we've developed here in Ontario. And we hope to be continually updating you and giving you those totals as we become confirmed and we're aware of those. And those are spread out over a number of health units, mostly in the Southern Ontario area, and of course a lot of them in the Simcoe-Muskoka area related to the outbreak at the Roberta place. So, also today, I want to confirm that Ontario is going to report its first case of the so-called B1351, or the South African variant of concern in Ontario. This was detected in a resident in Peel region. This case is under investigation, has no history of travel, and no known contact with person who has traveled. The public health in Peel are continuing to investigate it and are performing appropriate case and contact management accordingly. We'll continue to provide updates on this situation as the investigation evolves. So, what about the South African variant? We have noted that it's been reported in several countries globally, with over 600 cases being reported, depending on testing and methodology at this time. The predominant circulating strain is in South Africa. It was first reported in December of 2020, and following its detection early in October of that year. In addition to South Africa, 22 other countries have detected the South African variant thus far. In Canada, 6 cases have been reported in Alberta as of January 29, 2021, and 3 cases have been reported in British Columbia, and most of those have a history of having have traveled around, but some have no travel history outside of Canada or unknown status at this time. So we have ones with travel history and some without travel history. In terms of transmissibility, data from South Africa indicates that this variant quickly displaced other circulating lineages in that country, and it appears to have a higher viral load, which suggests that it may be more transmissible. Currently, there is substantial uncertainty as to whether the South African variant causes a change in disease severity. However, studies are ongoing to describe the epidemiology of the new variant. What's our response in Ontario? We have performed and given to the government our 6-point plan to enhance the existing efforts of the province to detect, track, trace, and contain the spread of the COVID-19, and in particular the variants that are being presented at this time. The plan includes updated public health guidance, enhanced laboratory surveillance in response to the new mutations, including the South African variant, and we talked about this last week with Dr. Brown. It also includes mandatory on-arrival testing of international travelers arriving at Toronto's Pearson International Airport, and that testing was put in place today at midday. In addition to these steps, it remains essential that Ontarians continue to adhere to the stay-at-home order and rigorously follow the basic public health measures that we've said, because the protection against these variants of concern has the same methods of our COVID-19, namely stay at home, limit your contacts to household members only, masking in public places or internal places, distancing 6 feet, especially wearing a mask if you can't maintain that all the time. And you have to do that even more stringently, especially the UK variant, which is shown and known to have higher and more rapid rates of transmission. So you need to do what we said before and do it well and do it carefully. And of course, if you're ill or concerned, do go and get tested in an appropriate and timely way to ascertain whether you do have COVID-19, and in more particular, if you have the variant, because now our public health laboratory system will be running all the positive PCR tests through our so-called 501 PCR testing protocol to see if we do have an expanding or changing number of variants within the province of Ontario. So we are putting things in place. We're monitoring the situation. We've had this our first South African one. I would doubt if it's going to be our last one. And also we have not seen the Brazilian yet, but it would not surprise me if we did see the Brazilian one in the future as well. But that's part of our high testing protocol here in Ontario. Rather than wait to see if it comes, we want to go looking for it and see if we can identify it as soon as possible, including put in strict screening at Toronto Pearson Airport as of noon hour today. So that's where we're at today. We'll updating you further in the future. But with that, I'm going to hand it over to the media for questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question.
From Jack Howan at Queen's Park Briefing. Please go ahead.
Hi, Dr. Williams. This weekend, 3 northern Ontario cities issued warnings about opioids, and Toronto's Board of Health chair said that there were a record number of overdose calls this weekend. Do you think it's time for a provincial pandemic-specific overdose strategy?
Well, it's a very good question, and along with that, because we had Bell, Let's Talk we had a day last week. We've seen a rise in a number of some of the mental health conditions this pandemic has been stressing for everybody. The amount of isolation for those who have some issues and disorders has been exacerbated, and we're very concerned about that. Including, we find a lot of people, especially with our opioid issue, because we have a strategy in place. We have our CTSs. We have continued to fund that. We've enhanced their funding as well as further funds for PPE for them to maintain vigilance and work at their various centers. Nevertheless, it seems that, especially in our high-risk cohort, we've seen increased number of deaths, especially those, unfortunately, that in spite of our past messaging, to not use alone, to be in partnership with someone else, with access to naloxone kits, etc. A number still are entering those type of events, and the pandemic, of course, increases that likelihood of undertaking when they're using drugs in a separate or isolated situation, which we really don't want. So we really have to look at any new strategies we can do as we go forward. And of course, we're going to be looking at how, when we get to our priorities in that, utilizing vaccination in protection against COVID. But that issue deals with more of our ongoing program to make sure that we can deal with other new suggestions and ideas, maintain what we're doing, continue what we're doing, and see what we can do to overcome, especially those that are now more than ever using drugs in isolation or alone, which is very sad. And because that group there is still our cohort, mostly of males, ages of 30 to just under 50, and that tends to be still a strong cohort that tends to be passing away due to the impact of opioids at this time. And so it challenges all what we must do to try and deal with this, because these are all individuals, and we know our people in the CTS ones are strained like everybody else to keep up with this task, and we're concerned about their status as well, to make sure they contain and can continue on the job, because it's not easy and it's challenging under all circumstances for all our frontline workers. So we do need our strategy to keep tuning that, and I know that Dr. Heyer, in his normal role of Chief Coroner, is also very concerned about this issue here in Ontario, as well as on a pan-Canadian basis.
Follow-up?
So specifically, though, what are some of those strategies that you're going to have to look at going forward? I mean, it doesn't seem to be getting any better. So when is the time for something like a safer supply program?
The Safer Supply Program is one of the things that is being put forward. We also want to look at the aspect in there, as I alluded to, how well are we making sure that these individuals are still into some sort of community of care. Even though we're in the isolation, we've moved some into some isolation facilities with monitoring. What other sources and resources can we put in place to that? Because the safer supply is one aspect, but if individuals still are choosing to use in isolation alone and get into a compromised situation, that what makes it very difficult to help them at that time. Still encourage them to go to our CTS sites, and how we might want to enlarge that and enhance that. So we're looking for a wide variety of suggestions from our experts, and those are involved in the front line, along with a suggestion and the point you've made. We'll have to continue to have that brought forward for review and see how we might want to do that. But our first challenge is to continue to resource all our CTSs and to approve, as we have recently, more capital expenditures to improve their facilities, and to make sure they have all the proper PPE and equipment they need to undertake the tasks and the very valuable tasks that they're doing at this time.
Next question.
From Carrie Verima at CBC National News. Please go ahead.
Hi there, doctors. Sudbury's mayor says that he's going to ask the province to step up highway checkpoints and to create them on a 69, for example, between Sudbury and Toronto, to ensure the stay-at-home order is enforced. He's blaming the variant being in Barrie, and of course we're seeing kind of the variant take shape. You mentioned the South African variant being in the province now. If that came across both your desks as a request from the medical officer of health in that region, or if cabinet was musing about this, what is your position on it? Dr. Yaffe, I know you've commented on this kind of in the past, but given the concern of the variant and the risks that it could become the dominant strain, what is your consideration of the mayor's request?
I'll start, and maybe Dr. Yaffe has something further to add. We've had some comments and discussions about certainly interprovincial travel, and we've discouraged people from going to other provinces if they have, especially from high-risk areas, and to stay at home. That's what the stay-at-home order means. The stay-at-home order also means stay at home and don't travel intra-provincially if you haven't got an essential reason or concern. So we've been looking at some of our mobility data. It shows that we have curtailed that to some extent, but I know that some of the mayors and leaders in some of the communities in the northern parts of the province are still concerned about travel up to those areas. Some have been concerned, and that's why we've had limitations on aspects related to ski resorts, because that brings people from the southern areas up to the northern ones to go there, and we've held that in abeyance at this time to try and limit that. So we haven't had a specific one. I haven't received a specific one from the mayor of Sudbury yet. Doesn't mean I won't. I may have approached more the minister or the premier on this regard. So we have yet not put in place intra-provincial restrictions, except to ask people, if you don't need to go out and go to other places except for essential reasons, then stay at home. and do that while we have our stay-at-home order in place. That's what's meant to be, stay at home. And how do you do that and maintain that? I don't know if Dr. Yaffe, you have any comments you want to make further on that?
Sure, thanks. I certainly haven't seen that request either, but as Dr. Williams said, it could be with someone else at this point. I think in principle, the concern is we do have the variants. We have the UK variant, and undoubtedly some of them are not connected to travel. We now have the South African variant case, and it's still under investigation, but so far no connection to travel. So it is a concern. The good sign is that the number of cases is going down. The issue of concern is that we're getting the variants, and those variants are more transmissible, more infectious, and spread more quickly, and could become the predominant strains if we're not careful. So I don't know that implementing a travel border within the province is going to actually accomplish much. We need to keep pushing about people to follow the current public health measures, stay at home. If they may have to cross the border to go to work, and that's a lot of extra efforts for people at the border. And really, what would it achieve? Because most of these people may have no symptoms. If they have symptoms, they shouldn't be going out. So it's reinforcing the general messages, and the fact that now all positive cases are getting tested for the variant. The public health units are implementing more aggressive case and contact management as much as possible. And so these are all the measures that are being taken to hopefully contain the growth of the variant cases.
Follow-up?
And yeah, just kind of following up on that, we saw just kind of coming up from the city of Toronto in the last 2 hours about this outbreak at Belmont Meats. At least 2 of the cases are testing positive for the B117 variant. This has been a question that a lot of the colleagues on the media have been asking about, doing more to address outbreaks in these industrial facilities. We saw with Canada Post last week, the announcement on Friday to get more rapid tests into some of these institutions. How quickly can we really get on top of this, given that it is such a large source of these outbreaks, particularly in the hot zone of Southern Ontario?
So it's a good question, and we know that our health units are identifying more and more workplaces as the sources of outbreaks. We now have the added capacity, which we didn't have even 3 or 4 weeks ago when PHOL, our laboratory, developed their PCR for the 501 mutation. And so as a result, in order to identify any variants, it would take us up to 7 days to 10 days if we happen to find one. And now with this method we're trying to implement where all the positive PCRs, if they come back, we will screen them through that method to identify any variants as soon as we can. As Dr. Yaffe was alluding to, the methods that you would use in a workplace with a variant are the same methods you should use with COVID-19 in general, except to be more stringent on it and do some more testing in that manner. And so it really emphasized the need to maintain those principles. And that's why we have a lot of work with now the Minister of Labour and MOLTSD in general to do more inspections with their inspectors around to ensure strict adherence to the occupational health and safety standards, and then working with public health when you do have cases in a workplace to move quickly to wide testing, as you did in the postal center that you alluded to there, and with other sites. We're hoping to use more the rapid antigen testing for some of those business places who want to undertake to do that. That would be for screening in their facility, that where they not sure they have any cases at all, but they want to make sure they're testing their staff on a regular basis. They can broker that and obtain those type of antigen tests and at their cost and carry those testing out on a regular basis, as some have done. In that, if there's outbreaks, then public health units will utilize various methods to make sure they test and assess that workplace as quickly as possible to limit any further spread. So with the variant, it just tells you we have to maintain strong vigilance in our measures, strong adherence to our case contact management, and as you've alluded to there, as our numbers are coming down, health units are being able to quickly address more and more workplaces and move on them quickly to seek containment at those sites. So all important, all we need to do it again, do it consistently. And now we have this extra technology. We can utilize it even in a more rapid method that we're going to see. You're going to see in Ontario, we're going to identify more of the variants of concern than other provinces and territories just because we now have the technology to bring that to our awareness and move it more quickly and rapidly. So, and we're hoping to share that. We are sharing it with the National Medical Laboratory, and maybe other provinces will utilize the same tool that may assist them in dealing with variants in their own jurisdictions. So our work is ahead of us, and as Dr. Yaffe's alluded to, and Dr. Brown said last week, it may become the dominant strain. Right now, so far, it seems that our stay-at-home methods have contained it from being to the wide level that where we were projected to be, but it doesn't mean we can just sort of coast on that. We have to make sure we can put those constraints around with more active testing, more aggressive case contact management to make sure can we keep it under containment, because the methods of protection are the same public health measures, but we cannot be casual about it because they transmit, especially the UK one, even more readily, and we have to be more careful even than we did with the COVID-19 of the regular strain.
Next question. Oh,
Canadian Press.
Which is, I think it's important for people to realize that in workplace outbreaks, oftentimes what we're finding is that the issue is that people are letting their guard down during their breaks or carpooling. So those are important things to keep in mind. You can't let your guard down during a break. If you're taking your mask off to eat or drink, make sure you're at least 2 meters away from other people. Try not to carpool, and if you must, keep as separate as possible wearing masks. So those are kind of important things to keep in mind, that obviously there's the usual important measures in the workplace, but those need to be kept in mind as well. Thanks.
next question.
From Sean Jeffords at the Canadian Press.
Hi, doctors. Just wanted to ask Dr. Williams a question, a follow-up actually about some comments that he made this morning. Dr. Williams, you talked about the dialogue between the government and the public health units on school reopenings in the regions where they still remain closed. And you made a comment saying that, you know, when their plans are ready to return kids to school, that the province was ready. I'm trying to understand if you mean that the province's work on the return to school plan is done and that you're now waiting for a finalizing of the work at the local health unit level, or is it something else? I mean, are you essentially just waiting for the okay from public health units to reopen schools in those areas?
It's a combination. We're looking at the data. We did assess it, and that's why we've done it incrementally. We did the north first because they had the lowest transmission rates. Then we did the 7 rural health units that had, again, lower transmission rates in our old framework. And then we looked at the lower end of the so-called red zone, which had numbers under 100 per thousand there, and asked a number of them to say, would you consider opening schools at this time? And do you have in place, if there was cases, to do aggressive surveillance in there, or could you put that up and running fairly quickly to look at it, because we want to make sure that's all prepared, especially if they were going to go down to much like with Toronto and Peel. When they moved up into that level, they went to the one symptom, mild symptom or posse symptomatic we talk about. And if you're going to do that, and that evokes a lot of demand for testing, is it going to be such that the parents are not frustrated by the fact they couldn't either get access easily to the assessment centers, they couldn't get appointments easily, and then sometimes the testing had a slow turnaround time that we experienced in the fall. We have put things in place, even with Ontario Health, to increase the capacity of our assessment centers, so that's ready. A number of the load on the assessment centers is moving off because the long-term care homes are moving their testing over more to be on-site rapid access testing, antigen testing, if you may. That gives us a bit more buffer and room. And then we're going to make sure that we're going to make antigen testing available to health units who want to and may want to undertake to do that, and put that in place so that if parents are concerned or not sure if their child is symptomatic or not, they could get the testing done, and could they get the testing done in a timely way so that they could assess not only the child, they may want to check the other siblings, or even the parents may want to be checked too. And so we've been working at how we're doing our part to make that ready, as in changing the, getting permission from Health Canada to change the testing methodology from nasal pharyngeal swab to a lower nasal swab, and then to change the regulations to allow not only regulated health professionals but other ones to undertake to do the testing as well. So trying to make it as accessible and reasonable and rapid that people could be assessed, so that this was not seen as a barrier for parents, but seen as a tool that they could do to quickly assess and to be assured in their mind that their child was fine and that they're going to get reports back that the school is fine, so that they want to be persuaded that there is no transmission occurring in the schools. We kept that under control in the fall, and we want now, with still relatively high levels of transmission in some areas, to be able to open with these extra things that the minister announced this morning, and as well that public health would say we're going to move quickly and to deal not only with symptomatic children, with mildly symptomatic children, or even ones that may have just been symptomatic and the parents are still concerned and they may want to have some testing done. So we want to make sure that what we're putting in place and what the health units are putting in place, so that they're saying, as many a medical officer of health, all of them are saying, we want the schools opened and they want the children back in school. So we're trying to make sure that we're connecting on that, and that when we're all ready to go with our numbers coming down very nicely, that I'm hoping that by next week, we could, the week of the 8th of February, to have our schools open across the province. So that's the goal we're striving for, but I want to make sure that's done in full consultation with medical officers, so that they're agreeing that, yes, we're ready for it, we can handle that. And the Minister of Education as well. So that's what we're striving for, and we hope to be able to ratify that with recommendations, because it has to go up to the Cabinet for recommendations. And so we're going to hope to give those to the Cabinet this week.
Follow-up?
Dr. Williams, more broadly, I'm wondering if you can talk about the message we were hearing on Friday, the idea that you need more data on the variant to determine when and how the lockdown and stay-at-home measures will be lifted. And I'm wondering if it's basically a foregone conclusion that they won't be lifted next week when the state of emergency expires, and how much time you need to evaluate the data. Do you need 2 weeks? Do you need 3 weeks? A month's worth of data? And what does that mean for those measures? Are we in line for the lockdown for another month and a half? Can you give us any sense of a timeline?
So we are in the process of, continually reviewing the data with the government, with the Cabinet. Our public health measures table is reviewing the different metrics on there, looking at how we can get our case counts down. Because remember, our target, our goal during the stay at home and the previous Boxing Day was to say, can we get our daily case counts down low enough that we impact the load on our hospital system? So we, in the modeling table with Dr. Brown, we noted that we really would like to be underneath 150 to allow them to start to resume some of their other essential and critical procedures that have been put in abeyance. But we've moved beyond that 150, above 200, and we're now above 300. We were over 400 for a number of days there, but now we're coming back down under that. So can we keep bringing that down? Because that was our target and our goal. And I said, if we can have that down below a certain level for a number of days to let the intensive care units empty out, and such that we give the healthcare sector a breather to make some room, so we don't have to be transferring people around to try and hold it. We're just keeping it together in that system at the moment. The sector has said we're stressed, we're being pressed. And add to that now, we've had the variants coming in. And with our technology, we're doing a point of prevalence test on a certain day. We hope to get that report from PHOL this week to see what percent of our cases are on a certain day, what percent are variants. And is that increasing? And as we increase these other measures in there, airport testing now required. The federal government's coming with some more things in the future. We're encouraged by that when it gets up and running. We're also saying that our positive tests coming through, we'll check for those. we want to make sure we don't, like in some countries that opened up, and the trouble is when you open up some things, it just sweeps wide open. And as you saw in some countries like UK and Ireland, when they got down to about the level we're at now, then all of a sudden, in a very short order, because of the way it transmits, it went up exponentially. And they're right back into huge numbers, and their systems maxed out writ large. So we want to make sure if we're going to make recommendations, and I know the minister and the premier are very concerned, we don't want to open up and then just crash and load back up again. So your question is a very important one to us. We're encouraged by the data right now. We're encouraged that maybe our stay-at-home directions and our measures are holding the UK variants and maybe some of these other variants at bay, because they all work. But we got to be careful how quickly we open up, and we want to assess, first of all, besides the outbreak at Roberta Place, do we have some around? And we know that we're identifying a number of the UK variants around our area in the greater Toronto-Hamilton area. That means it's there, and Dr. Yaffe and I have been alluding to that. We're confident that, we're not confident, we're disappointed that it may be already community spread of the UK variant. How bad it is and how quickly it's going to go, we don't know yet. And we want to be able to assess that carefully before we just open things up totally in there. And what checks and balances are we going to put in place to make sure we don't go the way of some other countries? And Dr. Brown alluded to that last week. And so if you're asking me, we're going to have to be appraising that and giving information. Our first target is, as we've always said, and people have experts said, the last place to close the schools and the first place to open is the schools. And that's where we're trying to go to. That's our first step. And then we're going to look at the other data, be encouraged if it keeps coming down, and then matching that with what the laboratory system and PHO is telling us. Are the variants rising or are they holding steady? Are we keeping it? And so we're in this very, as Dr. Brown said, I think the correct word, precarious position. And so the numbers are not down low enough to say the hospitals are out of the heat. They're not. They're still in the thick of it. We're not anywhere near the 150 yet. So we're going to have to see if that can get down there. It's going the right direction. Our outbreaks in some of the long-term cares are coming down. Other data is coming down. It's all moving in the right direction. We're back to now where we were about the second or third week in December. We have to get back to where we were at the end of October. So we have a way to go yet. And so we're going to be advising on that data. So I'd have to say stay tuned. The challenge we got first ahead of me right now is to get our schools open safely, have them open, stay open. And again, like we did successfully in the fall, limit down to pretty well negligent any transmission within the schools. That's what we got to do, even in the presence of the variant, even in the presence of high community transmission. We got to make sure we're going to be successful at, and that's what we're striving for. So I can't tell you how it's going to go yet, because there's a lot of things at play here, but we will be advising. And just like others, I want things opened up too, because people are hurting. It's not easy. It's challenging. We have our vaccine program going. We have a little setback now with the delay with Pfizer and with Moderna, and now we have some other ones coming on board. I know General Hillier and the rest of the team want to get that back up on track. We're covering our high-risk groups there. So there's a number of things playing out together here that we have to put into consideration before we would recommend some changes. So I'm going to wait and comment on that, but it's going to be, I think we're going to have to be very careful before we lift things too soon. But how soon we're going to do that, we'll have to wait till we see the data and the recommendations that our table would make through me to the minister, and then from the minister to the cabinet and to the premier.
Last question.
From John McGrath at TVO. Please go ahead.
Thank you. Good afternoon. I'm wondering, through January, we averaged about 55,000 tests per day, and we were supposed to be at a capacity of 100,000 tests per day by now. Given that we keep finding, variants and cases of COVID-19 that don't seem to be linked to international travel, how confident are you that the current levels of testing are sufficient, or do we need to increase them somehow?
So talking to Ontario Health, we have the capacity now to do 85,000 if we need to. With the rapid testing and the change we made, we hope there's going to be a large uptick in that across the province. So we want to monitor that because that is still testing. So if we get long-term care moving over to that, that's talking like 50 to 100,000 tests a week in there with the staffing doing 2 to 3 times a week. We're going to increase that. We want to have it available to our school groups too, to do more testing in that. We have the testing that Minister Lecce has said that their group is going to undertake to do. We now have the expanded testing at the airport. All these is adding up to more and more testing. So we want that. We want increased surveillance testings, we want increased diagnostic testing, and we want increased variance testing. So it's going to be 3 streams here. I think when you get the total of all those all together as we progress forward, we'll be well over 100,000 a day in many cases. We have more workplaces asking for rapid antigen. We've acquired more rapid antigen testing. We acquired different varieties. We now have a new another product coming in. So we continue to ramp up the testing here in Ontario. We are the leader in it. We do more testing than any province. Sometimes, many days, we're doing more in Ontario than the rest of the country combined. That doesn't mean we're going to be complacent. We're continuing to enhance that. But the right testing, right volumes in the right place, the right time, we're continuing to ramp up all those 3 areas there. As I said, we're ramping up now this whole new area of variant testing, and we have to move on that. So stay tuned. We'll keep updating on that. So you may get different data points in the future. You may get surveillance testing, diagnostic testing, variant testing, and I'm not trying to confuse you, but they are different things, and they're all critically important if they're done the right way for the right purposes that only but informs us and decision makers and the public of what's going on in Ontario.
Follow up, and this is the last question.
I realize that correlation isn't causation, especially right now, but when Ontario had its lowest rates of COVID spread through the summer, it was when, a person could walk up to an assessment center and get tested for any reason or no reason. And I'm wondering if there's been any discussion of reopening the eligibility for COVID-19 testing. At the moment, at least according to the provincial website, you still the presumption is that you still need a symptom, or you need to be one of particular groups to be eligible for testing. Is there any thought to, I know we're doing asymptomatic testing in schools and more widely, but is there some general move that we could make to widen testing even further?
So that's exactly what I was talking about, that for the people who have no symptoms or just want to be assessed, we would use surveillance. So people could go and get a rapid antigen test in a work setting, maybe relate to a school-type setting, and maybe in other types of settings that they can go and get that. The pharmacy. We have some pharmacies doing that right now, some in the range of 1,500 to 3,000 tests a day. We may enhance that and make it available as people go there. So we want to make sure our PCR test is for diagnostic purposes because it is a complex test, but it's our gold standard. So if someone wants to know that they have the diagnosis, because if you're screened and you get up a positive test, we're looking for confirmation with our PCR test. Why do we want that? Because we're hoping, as I said earlier on, that in those cases that are deemed to be a COVID case, potentially a variant of concern case, all those PCRs are then going to be taken through our variant testing to see if they are or not a variant, and going on from there. So by opening up a lot more antigen testing, we can get a lot of people who are saying, I just like to check it out. Can I be unconcerned? So we are ordering a lot of more of those tests and having other venues where you could go and get that done there. Right now, taking the load off the assessment centers, they can still go and get tested. We're asking that they still have signs and symptoms because that's our gold standard for diagnostic testing. But you're asking, can we make more available to the public for screening purposes? And we're trying to look at our areas where we want to focus that, travel-related, school, long-term care, our areas of most concerns, workplaces, enhancing that aspect there, and other high-risk locations that we'll hope to have available. So these are all possible. We want to keep looking at how we might do that as we go forward. And then, of course, in parallel in that, with the changing, we got the vaccination. That's happening at the same time. So there's a lot on the move here at the moment, and reason for optimism, but always concern and being cautious, and because we're in a precarious time at this as we monitor the situation, because we're in a global situation. And that's why we're doing the travel restrictions that we started today and working in concert with the federal government, how we would even enhance that further, not only from airport arrival, but also maybe looking at land transfers as well. I think Dr. Yaffe wants to make a comment.
Yeah, thank you. Just to add, if you recall, when we had people with no symptoms going for testing, what happened was the system got overwhelmed. People had to wait days to get a test or wait in long lineups. And then the turnaround time for the results, very important. The test needs to be, we need to get the result quickly so that the public health units can do their work in an efficient way, follow up on the case, identify the contacts before they become ill and spread it to other people. So if you open it up, you're going to increase the turnaround time for the test results and, in fact, reduce the effectiveness of the whole system in terms of case and contact follow-up. So as Dr. Williams said, we now, with the ability to do the rapid tests, those people who are concerned, who have no symptoms but are concerned, have that avenue. But they really should not be going for the PCR test at an assessment center unless they have symptoms or have been identified as a contact or part of an outbreak by the health unit.
Thanks, everyone.